Welcome back, and thank you so much for staying with us. If you're joining us right now, we are speaking about the nationwide drive for the vaccinations by the Ministry of Health, that is measles, rubella, and of course typhoid. Now it's ongoing as we speak, and Dr. Evans Amukuya here is here to elaborate why it's important and dispel some myths and fears and concerns. And thank you so much for your feedback. We'd ask you a question of the day about what your concerns are on the same aspect of the vaccinations, and we've read a couple of your feedback right before we went on break, and right now we have more that of course I want to highlight for Dr. Evans. Now let me read a few for you. They'll be on your screens just shortly, of course highlighting your concerns on this particular matter. Earlier on, Dr. Evans, you saw, one from Mary and others who were saying, how do I know this is safe for my child? How do I know, this is okay, right? And you're able to say that most of the, health workers are trained nationwide to be able to administer this, right? So let me read a couple. We have here one that says, good morning. My question is, my granddaughter had already had the vaccine for measles when she was a baby. Now she's 4. Does she need the vaccine again? 2, for an autistic child, is it safe? Okay. You can answer that one first. Or if my director, according to Miss Casa, all right, okay, that you can answer that for now. We'll highlight others as you go.
Okay, as we said earlier on, is that even if you are vaccinated, not all people are immunized. Mm-hmm. So up to about 15% might not be immunized, okay, despite being vaccinated. And even when you vaccinate a second time, probably another 85% of that one may be immunized, but another leaving a small number there. That's why we keep on repeating, hoping that, but if they come twice, generally, you'll find over 90-something, 99% will be immunized. That's why we do it. And when you're doing a public health, campaign, if you start picking them out, it'll be difficult unless you keep on checking the blood to see who is immunized, who is not immunized, and then leave those who have been fully immunized out and the other one. Yet it does not cause any effect even if the fully immunized is immunized another time. Mm-hmm. So it'll protect that child, but also for public health purposes, it's easier just to immunize everybody.
I see. Yeah. And she's also asked, is it safe for an autistic child? We had mentioned this earlier, but you can elaborate again.
It's very, very safe for autistic child. Very, very safe for autistic child. The concern was not whether it was safe for autistic child. The concern before was whether it causes autism, which all the data has shown it does not at all cause autism.
Okay. Yeah. So one has to, understand the difference. That's why I'd asked you earlier. But I think we just need to repeat that since it's a question. The report was there, was done by Lancet, that there are concerns of autism, that it may cause autism. Yeah. But you're saying it was dispelled a while ago. So there's no...
It was actually a fraud. It was actually, the person who brought it up was people in your profession. An investigative journalist came in, and then when they investigated, they found out that that data was actually cooked, and he was even deregistered as a medical doctor, and the paper was withdrawn. And many other studies have been done for that, many other studies, and none of them has shown any relationship with autism.
Okay. Yeah. All right. Let's go back to your perspective. You were answering my question before the break about vaccines that have to travel, across counties, and maybe they need to be in cool, temperatures and the like. But you said when it comes to a particular exposure, they would change color. Yeah, change color. Yes. So just give us that elaboration better.
Yeah. For all vaccines that require cold chain, there is a lot of training for the people who handle those things, and then they are kept in that particular, and they're for different. For example, as it be kept for a certain longer period, for a certain temperature, and they are open. There's a certain time that's supposed to be there, and it's all written. But despite that, we have a second thing on top of that to make sure. So on each and every vial, there is some kind of thing that senses the temperatures. So if that temperatures goes up for a certain period cumulatively, then it means that there's a chance that that vaccine might not be effective. Right. So for that, if you see any of that, that color is discarded. So every time we're looking at, we look at those things to make sure that they don't have. And even when we go checking, like independent, we actually look. We not only look if they are working, we actually also ask them how does it look when it is expired, so that we know that they can be able, and if they've been trained on it, and they say they've been trained on it. So we just make sure that that one doesn't work. And if it does, we throw them away. Any vaccine that has that is spoiled because of temperature is thrown out.
Okay,
yeah.
I see. We also need to, highlight, this very crucial matter of expired, vaccines. Also in the news, I don't know, you saw it, the issue of expired drugs and the like, and them not being removed, from counters or some health facilities, So how does one ensure that they're getting something that is up to date? You don't want to assume that because there's, a drive and the like, that, there are people who may or may not are there. We have some clinics, or some, outlets, facilities for that matter, who may say, okay, fine, I may be missing this, maybe I'm going to put this until I get this particular stock. And someone may not even know. The person requiring a vaccine for their child may not have any indication. So how do you go about that?
The best is to believe that the health workers are doing the right job. I think the best thing. But if you really want to put your finger into the wound,
you have to put your finger into it.
You can still ask them to show you the vial. And they show you the vial, you'll show, you can show what colors are there. You can show you a booklet.
And also a date?
And then the date is there to show when it's expired. You can actually, if you want, you can counter check each and every medication you give. Even the ones that prescribe, there's always date of manufacturer and date of expiry. But for the vaccine, it's not only date of manufacture, date of expiry, whether the quality is still okay, whether it is still in good condition. So all those three can be checked if you want to check it. And I don't think anybody can stop you from, if you want to confirm that that vial is
no one can stop you. You're sure?
It is your right. It's your right.
Okay. Okay. Let's go back and also highlight hygiene standards. I like that you pointed out before we had even the interview, the conversation, that the syringe is it. Not just the needle, the whole syringe should be new when every child is getting, vaccinated, right? Yeah. So just elaborate for that for us, so that any parent out there, whether they know or not, but it's just clear that this is not something that should be shared whatsoever.
Okay. Because on some rare occasion, apart from just reaction, a few people might get infection at the site of injection.
Right.
And the site of injection could be because probably of the needle or probably contamination. So to avoid that one there, each and every child gets a brand new needle that is thrown away. And we're also not using any syringes. So once we are finished with it, we actually discard it. So every person who comes there, you find a completely new needle that's big. In fact, it is done in front of the patient. So you see a new needle being opened, being put there, and then it's thrown away. So it does, and then of course cleaning the site at where they're going to inject the child. Yeah.
All right. Yeah. As simple as that.
As simple as that.
So when you're telling me, at times you may find where the vaccine is where you got the injection. Yeah. When there's swelling, in some cases it's infection.
Yeah.
Or just a normal side
on very
effects.
rare condition, it might be infection, or it might just be a reaction. So it can just be rare, or it can be actually infected. But that one, we are seeing very few of them. So when I went around, a bit of redness I've seen, but one that causes things like pus or something I've not seen when I went around.
And in the cases where you see pus, what does that mean? What does that indicate?
It means it's infection.
What kind?
Most likely from your own skin, probably they didn't clean it properly. Oh. Yeah, if you didn't clean properly and then the infection went in. Yeah.
How long does it stay, before it goes away for those children who may unfortunately get fevers, swellings, numbness?
Less than 2 days. Most people is less than 2 days. Yeah, less than 2 days. But for measles and rubella, a few cases might get mild rash that can disappear, and that can occur a few days after the vaccination, not immediately. So, and that also takes a few days also, and it doesn't bother the child. You might find the child even just go in school without a problem. So a mild rash might occur with measles and rubella.
Okay. Yeah. And is a parent supposed to do anything for that matter? Others will leave the child. Yes.
We're supposed to report any case. If you find anything that happens after you've been given the vaccination, go and report to the nearest health center, because we are recording each and every case, and we have to make sure that it resolves without any issues. So, and if it requires any treatment, we'll give treatment. So if you find anything, even if it is not related to the vaccine, but was given after the vaccine,
and then it happens.
It happens. Yeah, you come, even if he starts coughing because of something else, just come. We'll record it, and then later on there's a team that looks and decide whether it was related to the vaccine or not.
Okay.
Yeah, because you might even be having some other disease that was appearing, that was incubating, and then during that particular period you get a fever, and a throat infection or an ear infection due to something else, not due to that one there. So but it'll be up to us to really sort that one out.
Got you. So you mean that in some cases, some diseases which were incubated within you can get triggered when you have some...
Not can get triggered, but it was just going to happen anyway, whether with or without the vaccine.
Oh, it has nothing to do...
Nothing to do with the vaccine.
With the vaccine.
Yeah, nothing to do
you
with
may
vaccine.
just...
Yeah, you may just have been incubating, and you're going to develop that disease in the next 2 days. And so whether you're given the vaccine or not, you're going to develop that fever.
So with that feedback on your end as health practitioners, what does that mean? Because you're saying, fine, you'll record it, but this thing has just shown itself because it was there already, either way. So what does it carry? What meaning does it carry here?
One thing we don't want to miss any cases, so don't say this one is due to the vaccine. So we pick everything that has occurred, and then later on the team can try to sort out what was due to the vaccine, what was not due to the vaccine. So we do not want anybody to have something to say, oh, he had malaria, he had something. No, whatever you have, you come to hospital, so that we can see that after following the vaccine, what happened to all those children there. So any case that happens, whether the child had an extra, but if they won't develop after, if they won't come after anything else, just go and report to the nearest health center.
Okay. Yeah. Now, I want to read feedback here, and again, it's another concern, and I believe this is a parent or a caregiver for that matter. Her name is Joyce from Nakuru, and Joyce here is saying, or rather, let's begin with Peter from Mombasa for that matter before we get to Joyce. Peter is saying, I'm worried about the rumors going around in the community claiming that these vaccines have hidden agendas. I wish the government and health officials would address these rumors directly and openly so we can protect our kids without fear. Yes, which I'd asked you earlier.
There's no other agenda. The agenda we want is to reduce the typhoid. As you know that typhoid gives you diarrheal, sometimes you're bloody, sometimes can even rupture your intestines. Rarely, but it can occur. The treatment that we use, many of them are getting resistant. So the antibiotics that we are using, many of them are not working. Yet the vaccine can actually prevent even those that antibiotics will not work, even the very expensive antibiotics. So that is for that. And for measles rubella is that despite our vaccination, large number of children, and every 3, 4, 5 years reaches almost the birth cohort. That, for example, if 1 million children are being born, and about 15% are not being vaccinated, plus the ones who are vaccinated, another probably a percentage are not. So cumulatively over the years, you get now a large number of under 5 children who are at risk of getting measles.
Okay. Yeah. Right. Let's take a look at more feedback here from our viewers. Seeing one here from David from Thika. He says, I feel uneasy because sometimes we hear conflicting information from different sources. As parents, we just want clear, honest communication from health experts. We want to do what is best for our children, but we need to trust the system first. Okay. There's something resounding here. Doctor, and Joyce from Nakuru says, I worry about the timing of these vaccinations, are they being rushed because of an outbreak, or is it part of a regular program? And to be sure that this is being done for the right reasons and that my child is truly safe. Okay, so I think the issue here with, we've seen most of our viewers is the information that is being disseminated is not clear. And there's a lot of mistrust. Is it that, you know, by the time there was this nationwide drive, there was not clear understanding on why these vaccines are being, you know, done at this moment? Or what do you think the disparity is? Because there's a clear issue of communication and mistrust from the public.
I think we'll do a postmortem to see, because I thought this particular time there have been a lot of discussion, including this one we are discussing with you now. But it looks that probably we have not communicated well in terms of why you are vaccinating, why now, which I've already answered. I can answer again, and whether it is safe or not safe, because we know that it's completely safe. We know why now, because the number of people who are unvaccinated, unimmunized, not in measles, and the measles cases have gone up. Last year, even this year alone, the first 5 months, we have got about over 600 cases.
So then one of the, I think it's Joyce or so, who's saying, why then? Why are these numbers on the rise, you know, in this manner, in this alarming manner?
Because, you know, if you don't take a child to be vaccinated, you increase the number of children not being vaccinated. And as I told you, if one patient comes in the room with 100 children, 90 of them will get sick.
Okay.
So once you don't vaccinate a child, you're increasing the pool of people, and once you do that, you can start an outbreak. So if all the parents would go to the place that we have, at least we aim at about 95% of all the children born are vaccinated, we can actually reduce this. But still, despite that, about 5 years later, there'll still be the 5% who are not vaccinated, and there still be the 15% who are vaccinated but not immunized. To reduce that one there, go for the second dose. The second dose at 18 months is, we get very low uptake. If that one went also to 95%, probably we can even reduce the number of these campaigns that we do. The campaigns we do now, because if we don't do it now, there'll be a huge outbreak of measles, because there is a lot of susceptible children out there who can get. Even for typhoid, it goes even up to adults, they can get typhoid. But the number of people who get in large numbers and die is children under the age of 15. That's why we are giving children under the age of 15. But it can still be given to adults. But for public health purposes, we give to where there is the highest burden and highest.
Okay. I think another very important factor is the issue of culture and religion. When you're going across counties, people have different beliefs, and some, you know, because of their religious backgrounds and cultural backgrounds, they don't believe that, you know, getting a vaccine will go hand in hand with what they believe. You know, if anything, they feel it's introducing other things into the body, whereby natural medicine, you know, herbal medicines and the like can be able to, you know, help, you know, for this factor. So when you're going to sensitize different communities, how do you speak that language and make sure that, you know, they understand the kind of information you're saying? Of course, given we're in a time where technology is vast, so many people are aware and they are savvy, but we cannot take you know, the fact that away where most people are still very core in their beliefs. So how do you handle that?
Okay, I'm not at the forefront in that particular area, and there's some experts on communication in that area. But as an advisory group, we actually insisted that all the stakeholders be involved when you're doing those things. This came when there was a big cry on the tetanus toxoid, and I think I won't mention, but one church was, at least a member of one church, they were concerned about it. So we decided that those ones should be on the table when they are introducing any new vaccines, or
so they're part of the conversation.
The conversation. So as advisory committee, we give that we give the advice. So all the stakeholders are there. Even those who are against should actually be on the table, so they can listen to their concerns. I can listen to the concerns, and we can answer the concerns. We can wait for natural infection and get immunity, which is quite good. But unfortunately, you'll also lose children. You also get people who are probably deaf. You may get people who are blind. Measles can make you go blind. So if you want for natural infection, we can leave it that way. They will get immunized of that infection, but we'll lose several people and get many people who are hurt, who are injured.
I see. Yeah. But in your scenario, how do you make it practical for them? You know, because I don't think per se the issue is what can happen after. Some of them have maybe even been living with, you know, the effects of measles. They've been gone blind, you know, they're affected mentally, but they're used to it, and they'll have different explanations to that. So it's to tell someone or convince them, by the way, this can change. Yeah. You know, because of A, B, C, D. Yeah. So how is that work? I know you said it's not your, you know, your department, you know, your expertise. But just for the sake of our audience, you know, how do you make that conversation practical?
For measles, it'd be scary even to bring a child who is injured. But for other things, for example, like polio, we have had experts. I mean, not experts. We've had people who have suffered from polio who work with us, and they can actually walk around and inform people that if I was given that particular vaccine, there's a high chance I would have been having my full functions like you. Okay. But because it'd be nice if you get the people on the other side talking, because if you talk as the health industry, some people think probably I've got some other interest other than assisting them. So sometimes people who are really who have suffered from it, but I feel that it'd be unfortunate to bring somebody who has gone blind and to try and say that this came after the measles. But probably talking to our communication experts, which I hope probably can invite communication experts, they can probably tell you how they could go around that particular communication.
All right. Yeah. Okay, I'll keep that in mind. When we do have that chance, then we'll get someone in that, you know, with that expertise to, you know, explain further. Right. We have more feedback, so I want to read a couple from you. We have one here that says, I worry about the timing of these vaccinations. Are they being rushed because of an outbreak, or is it part of a regular program? I want to be sure that this is being done for the right reasons, that my child is truly safe. I believe I've highlighted this, and I believe you've answered it, Dr. Muke. This is Joyce from Nakuru. Yes, so I'll tell my director, Kasavuli, we've highlighted this one in particular, and also, but we can repeat them. There's no harm in that. Grace from Buruburu says, my biggest concern is if my child will have any allergic reaction or severe side effects after the vaccination. I believe in vaccines, but I also want to know that there will be proper medical support if anything happens, okay? We also highlighted... yes.
It's true that allergic, you can have allergic reaction, which sometimes can be severe. So if you are given probably earlier vaccines and you reacted to it, it's better to inform your medical personnel. But we do have, all the teams have those drugs so that your child will be handled properly. There are vaccines. I mean,
the allergic reaction can happen at the, like literally on there.
Allergic can happen within minutes, and the medical personnel are trained very well and have got, and they all have the drugs with them to counter that particular reaction.
Okay.
Yeah, they are rare, but they can be scary. So that's why we have experts and drugs to assist in that area.
All right. So Grace can be assured that if she needs any assistance, you know, the health practitioners will assist her.
But if the child reacted probably to the routine one earlier on, it's better to inform the doctors so that we are aware that So far we have seen very few. I think there are probably one or two that I saw that have reacted, but it was mild reaction. It wasn't something severe.
All right.
Itchy or something. That
I see.
Yeah.
All right, Doctor, we've come to the end of our conversation. Thank you so much for being here and answering concerns, fears, of our audiences. We appreciate that. Thank you so much for coming. My guest this morning has been Dr. Evans Amukoye. We've been speaking about the nationwide vaccine drive.